Hello and welcome. My name is Kelsey Davis. Thank you for joining me for this case study on childhood obesity. Let me introduce you to our patient. Her name is Jane. She is a 14-year-old female standing at 5 feet 2 inches tall and weighing 152.9 pounds. Jane is a part of a family of 5, including herself, her mother, father, and 2 younger siblings. Jane's parents both suffer from obesity, her mother from hyperlipidemia, and her father from type 2 diabetes. They struggle to provide healthy food due to their economic status and food insecurity. Many of their meals come from fast food restaurants or even cheaper alternatives. Consistent and adequate nutrition is crucial for childhood development. And when food insecurity occurs in a household with children, it is associated with lower fruit consumption, iron deficient anemia, lower learning and social development, and mental health disorders. Due to this lifestyle, Jane has gained about 10 to 15 pounds each year for the past 6 years. If you look to the right, her body mass index for age is plotted. Her BMI is 28.2, and she is above the 95th percentile, indicating obesity. Additionally, her cholesterol levels are abnormal with a high LDL-C level of 113, a low HDL-C level of 36, and a high fasting glucose level of 116. Continuing with her diagnosis, I plotted her stature for age and weight for age and determined those percentiles. Jane's stature for age is in the 30th percentile, but her weight for age is in the 93rd percentile, indicating that she is in fact overweight. A high BMI, some may assume, is just an excess of food and that food is plentiful at home. But Jane's food diary does show a large intake of energy-dense, cheap food. With childhood obesity, there are a number of associated health risks and conditions and complications. If Jane continues her current eating habits, she is more likely to carry them into her adult life and will increase her risk of chronic disease. Evidence is now emerging that obesity-driven type 2 diabetes might become the most common form of diabetes in adolescents within the next 10 years. Her health condition and her food diary imply vitamin and mineral deficiencies as she is not receiving enough fruits and vegetables in her diet. Her high LDL cholesterol level indicates an excessive intake in red meat and saturated fat, which is very clear from the excess of fast food in her 3-day food diary. Low HDL-C levels indicate minimal physical activity and an excess in sodium, as well as her high fasting glucose level, which was 116, indicates that she is pre-diabetic. My major focus for the start of Jane's health journey is to set up a good foundation for healthy habits. As she moves forward, we can change these goals as needed. Again, her labs show that her cholesterol levels are abnormal and she is excessively intaking saturated fat, sodium, and has minimal physical activity. But much of Jane's health is dependent on her parents, meaning counseling and education is the first step for not only Jane, but her family. We will discuss what all of these levels mean and how to get them to a normal level, what a healthy diet looks like for this family, how they can meal plan, what snack selection looks like for this family, and goal setting. Nutrition education combined with behavior change counseling has shown to be effective in childhood obesity for weight control and dietary modification. My initial recommendations for Jane is to, 1, decrease her weight, which means decreasing the amount of calories she's intaking. Right now, she's between 2,200 and 3,200 calories daily. I would recommend going between 1,800 to 1,900 within my 3-day food diary. Or 3-day food plan, I did go a little below 1,800 calories. I would like to increase her servings of fruits and vegetables to tackle those deficiencies that she is facing. Achieving 60 minutes of exercise daily. National guidelines recommend that all children and adolescents engage in at least 60 minutes of vigorous to moderate physical activity each day. Ideally, some of this physical activity would be outdoors to help raise her very low vitamin D levels. Limiting fast food and reducing red meat intake is crucial for Jane's cholesterol levels. It would be best if the entire family decided to reduce this together and decided to be active together. A big question for families facing food insecurity is how to implement all of these recommendations. The U.S. government has 15 nutrition programs in place to ensure low-income individuals and families have access to food. Jane's parents would have to be willing to participate in grocery shopping for healthy food, willing to cook the majority of meals at home, and limit fast food intake. And of course, financially, this may not be realistic. In my 3-day meal plan for Jane, I included things like nuts, fish, avocados, which can all be very expensive without government aid. The purchase of healthy food items would be completely dependent on their economic status, which is why I recommend food programs like SNAP, the Head Start program, the National School Lunch program, and the National School Breakfast program. Food assistance programs are directly associated with a lower risk of obesity. SNAP can be used to buy fruits, vegetables, meats, poultry, breads, and cereals, and a variety of snacks for the household. The Head Start program aims to include nutrition education for children and their parents and supplies meals for children in the program. And the National School Lunch and Breakfast program requires schools to increase availability of fruits, vegetables, whole grains, and fat-free and low-fat fluid milk in school meals. Reduces the levels of sodium, saturated fat, and trans fat in meals, and meets the nutrition needs for school children within their calorie requirements. This program, the National School Lunch and Breakfast program, would also provide Jane with 2 meals a day, 5 days a week at the very least, which would take a lot of pressure off the family to provide those meals for her and ensure that she was getting the correct macro and micronutrients needed to be sufficient. This now leads me to my 3-day food plan for Jane. With this food plan, I aim to keep foods in her diet that were familiar to her and that have healthier alternatives. I wanted to make sure that she can cook breakfast on her own in the morning if she needs to, and things like that. So the first item is a great example. The Jimmy Dean breakfast sandwiches are very easy for Jane to heat in the microwave before school. She may not have someone with her helping her cook with the cooking process, and instead of the typical sandwiches she eats, which are sausage, egg, and cheese, I replaced it with the Delights, which includes turkey sausage as an alternative, an egg white, and a whole grain English muffin. Adding a cup of fruit on the side gives her a fairly balanced breakfast. However, I also tried to introduce her to new foods like salmon and avocados, which have great health benefits and will move Jane closer to a healthy weight and a better quality of life. In terms of snack options, I tried to keep them similar again to what she's used to. For example, Skinny Pop. It's an organic sea salt popcorn, and it may not be exactly what she's used to, which is the movie theater butter popcorn, which is full of sodium and fat from the butter, but can help her with her snacking and will eventually lead her to make healthier choices. All 3 days of these plans have a sufficient amount of micro and macronutrients to keep Jane healthy. If you have any questions, please let me know. Thank you.